Good afternoon. I'm Julie Shirley, Executive Editor and General Manager of the Bellingham Herald. Welcome to our first live stream event from multiple locations across Whatcom County. Today, we're talking with reporters Dave Gallagher and Dave Rasbach about covering coronavirus in Whatcom County. First, let me take the opportunity to say thank you to our donors and subscribers who raised more than $30,000 to help us continue our coronavirus coverage. The local media foundation has raised $1 million this year to support newsrooms around the country. We're so touched by your comments and your support for local news. Thank you. Before I bring in the Daves, let me quickly review our coverage from the last 3.5 months. We really have been sprinting a marathon. The first Washington case was January 21st. Shortly after, a Western student came home from China, and that led us to say, wonder what's going on in Whatcom County. We were surprised at that point to hear that the first negative test had already returned. We wrote that story January 27th. A month later, the county announced its plan, and we wrote a story on February 27th. The state's first coronavirus death was March 29th, and our county's first positive test was reported March 10th. With increasing calls for social distancing, most of our staff moved home the week of March 16th. 3 days later, Whatcom County's coronavirus first death was reported on March 19. On March 23, Governor Inslee told us all to stay home or stay healthy, but with news being an essential service, I stayed at the office at least until April 7th. Now, there are just a few members who remain behind in our Barclay offices. Videographer Warren Sterling needs the office for bandwidth to continue to edit video. He's been our staffer who's been most out and about filming live. He's fully stocked with hand sanitizer, masks, and gloves, and is very careful about social distancing. Also in the office, where he's best able to monitor breaking news, is reporter Dave Rasbach. We'll talk to him in a minute. Before I get to my questions, if you have questions for either of our reporters, please leave them in the comments on whatever platform you're on, and we'll get to those when we can. Dave Rasbach's been a reporter and editor here for 15 years, much of it in sports. His deadline experience has been invaluable in covering this fast-moving story. Dave, what's the most difficult part of keeping track of the coronavirus's spread?
Hi, Julie. Thanks for good to see you again. Obviously, it's been a big adjustment for me. As you mentioned, I was a sports writer for about 20 years, and you're not prepared to cover something of this size. You're used to covering games and filing your stories on deadline and being done with it, and had to learn medical jargon, medical terms, as all of us have. None of us were prepared for this. Also had to learn how quickly these stories evolve. For example, today I wrote a story yesterday about Bellingham International Airport just recommending that people wear face coverings. And about an hour before we went on here, they put out a Facebook post that said they are now requiring them. So had to update that story in a hurry to make print deadline. I've also found it very difficult to get the information that we need to accurately tell the story of what's going on here in Whatcom County. We've had some, the Whatcom Health Department and Whatcom Unified Command have done a good job of putting out numbers on a daily basis. They have not answered our questions in a timely manner necessarily to give perspective to people that want to know how prevalent the disease is in their communities. Obviously, there's a number of the disease in Bellingham is very different from what's going on in Linden, Ferndale, and Blaine, and these isolated communities within Whatcom County. And people want to know the information, what's going on. And we've done our best to try and give them that information, but we're not getting the answers to a lot of the questions we're asking for a variety of reasons. We also had some problems with the hospital getting us information at first, but they've started releasing the number of patients they're treating, and that's really helped increase the numbers of people that we're talking to. Lummy's been very forthcoming with the numbers, which is very unique. They're the only distinct community in Whatcom County that is releasing how many people they're testing, how many people are positive. They're also releasing the number of people that are recovered. And that's another thing we haven't been able to get an answer to, is how many people in Whatcom County have tested positive that are now recovered from the disease. So we don't know how many active cases there are in Whatcom County. Another place that has been very good about helping us with numbers has been the Shuksan Care Center. As soon as there was an outbreak, they took steps of hiring a liaison between us and them and the community, basically. And they send out until last week, they were sending out daily updates on how many people were still being treated, how many deaths they had, any new tests, when they started accepting new patients that are already tested COVID positive. They've done a very good job of getting the information out there that they need.
The health improvement, the HIPAA Act, has been made it difficult to figure out which number relates to which other number. I know that that's been a concern with a lot of our readers, and it's been a concern for us as well. Mm-hmm. Your interview with the nurses at the Shuksan Care Center got a lot of reader reaction. What was that story like to report?
Well, I was a little worried about going into that story. A couple of weeks before or a week before I pitched it, we'd written a story that talked about some of the troubles that Shuksan had with a previous management system, previous management that was not responsible for what was going on in the healthcare system. But we got a lot of pushback from both the care facility and some of the nurses, and saying that we didn't tell the whole story, and that story did not tell the whole story. We didn't tell about what it was like inside the four walls at Shuksan. So I worked with the public relations person there and told them the story I was hoping to tell, and said, basically, I just want to listen to your nurses tell me their story, and I don't know where this story is going to go. I'm going to let them take me there, basically, and just listen to them. And I asked very few questions just to kind of keep the conversation going with them, but just wanted them to putting them at ease that this is the story I was trying to tell. The battles they were fighting there inside Shuksan, and it turned into a story I wasn't predicting. Them talking about the family atmosphere there, and that was something they both said was how much this really hurt them, seeing the people that they genuinely cared for battling a disease like this, and watching and some of their greatest successes were just seeing people come out the other side, and the pep in their step, and getting them to see them out in the courtyard sitting up to eat a lunch one day. It was a rewarding story to be able to tell, and the response I got from it was very good.
Some of the other things that you've covered have been in the national news as well. One story in particular on the test kits being seized. How else are you reporting stories? I mean, it's a national story, it's an international story, but for us, it's a uniquely local story.
Well, I think that you hit it on the head there. It is a national, it is an international story. So we've got to watch what else is going on in other communities. The way that the story came about the test kits that were destined for Peace Health hospitals here in the Northwest, being seized by the federal government and sent to other facilities, you found a story from the LA Times that said that this was going on, and it mentioned it. And so when I saw that, I read that story and I asked them, and Peace Health was very forthcoming, saying exactly what had happened and what they were hoping the test kits would be used for. And so, you have to watch what other media is reporting. I get up and watch the TV every morning, so I know what's going on. In fact, that kind of generated why I asked Bellingham International yesterday about the wearing face coverings. I saw a story on one of the local TV stations saying that SeaTac was doing it, and I just questioned whether Bellingham International was doing it as well. And so it's just keeping up on what other news media is reporting, watching social media, listening to people in the community, because obviously we're not out in the community anymore. We're not talking to everybody, and so we just don't know. We need their help, helping us, give us leads, and we follow every lead we possibly can.
Great. All right. Thanks, Dave. Now, please welcome reporter Dave Gallagher, who's been covering business for the Herald for 15 years. Dave.
Hi there, everybody.
With social distancing, how have you been finding it working with sources to report your stories?
Well, I'm on day 60 of working from home, so which is definitely a different atmosphere than being in the newsroom. I've talked to my sources using by phone, text, email, Zoom. It's a lot more working that way, and obviously no face-to-face interviews, for business related stories. One thing I found is it's more difficult in terms of verifying people, to make sure I'm talking to real people and that they're telling me, real stories. A couple weeks ago, I had a story about, people on unemployment and how they were having difficulty getting state benefits, and it's usually with those kind of stories, if I don't know the person, I try to meet them face to face and talk to them and make sure, along with doing, background checks and that sort of thing. And, this time around, I had to rely a lot more, on background checks, looking online, making sure I knew who I was talking to. So it's a little bit more challenging that way. But for, a lot of my sources, I've been, reporting here at the Herald for 15 years. So I know a lot of sources already, and they've been very responsive about getting back to me, either by phone or Zoom or something like that. It's been great, connecting with people. There's, even when it's, bad business news stories, sources generally want to talk to me and get that story out there, even if it's, not good news necessarily for them. They just want readers to understand what's going on in the community, and I certainly appreciate that.
We've had a lot of comments from businesses, or they've sent us notes about when they're opening or closing or what they're adding to their offerings, which is great. We're happy to get those in the stories and get those out online for people. So something else on the business beat lately that's not really a coronavirus story, but certainly the Talco closure has been a huge story and a big deal for the community. How has this time of coronavirus changed reporting in general?
Well, it's definitely challenging. That's, something as impactful as Alcoa closing the Talco facility that's a huge story. And before the pandemic, we would definitely be going out and tracking down sources, visiting people, and talking about their experience, and even going into the Ferndale community and talking about what impact that is going to have on the community. This time around, it's again calling people, emailing people, texting. We had a Zoom meeting last week with some of the union representatives about that, and it and that worked out pretty well. It's gone fairly smoothly, and I think the other challenge with it too is writing this story and covering it in a pandemic. I mean, there's so many other things going on right now. It's hard to give it. I mean, this would be a story that would have wall-to-wall coverage, and that's been more challenging to do because there are so many big things going on in the economy right now. So it's a matter of just playing catch up a lot of time with this story, as well as all the other business stories that are happening right now.
So many stories all the time. How have you been deciding what to write first?
Well, news value obviously is the top for us, but also we've been learning so much about online. More people are reading us online and in print, and so we have a pretty good idea of what stories they're clicking on and how long they're staying on a story and how far they're reading into a story, and that the readers help guide us in terms of what they're interested in and what they want to read about. An example is Costco has high readership around here. We write anything about cost, so people are really interested in it. There's also, we found that people are really interested in local small businesses too, particularly, popular ones in downtown Bellingham. They, and they're also, hungry for news of places opening up or moving or closing. Even the smallest business sometimes will get a lot of clicks online. And so looking at that sort of helps guide us when we're getting flooded with story ideas, business stories to cover. And we just I just continue to try to work my way down the list. I was looking right before this video chat, and realized it's well over 100 stories since I started working from home. So I'm trying to get through them as many out there as I can. So hopefully we'll get to all of them here.
It does. There are a lot of stories out there. Dave Rasbach, I know that you had talked earlier about how hard it is with the pace of news, that sometimes stories get left behind, that there's something you want to do, and then all of a sudden the news breaks and we find ourselves moving on more quickly.
Absolutely. There's so many stories out there. I had to change we've had to change which fires we're reporting on, which cop stories we're reporting on, which, and there's a lot of good stories out there in the community. It's just how do you fit it into a 40-hour work week? And the good news is most people have been much easier to touch base with, just because everybody's a little more available right now. And so that helps speed things along a little bit. But you do have to pick which stories to tell and which stories to invest your time in that are going to help the community.
I know lots of people were interested in the story you wrote the other day about the woman at McDonald's who'd saved that man's life.
Mm-hmm.
It's a happy story for a change.
I look for those. I'm following a couple of those right now. I just sent some emails on them earlier today. Hopefully we can tell those stories as well.
Great. So this one's to you both. If you have comment, this was from one of our callers here, Marcus McGregor. He's wondering about testing. And I know that actually Key Relia has been doing a lot with testing for us at this point. But maybe Dave Rasbach can talk a little bit about some of the problems with tracking down government information.
In terms of from Whatcom Unified, what they have assured us is that we have sufficient testing in the county to handle every what the county needs at this point in time. We've asked them, we've pressed them on it a couple different ways. When Skagit County opened some a drive up or a walk up facility, we asked them if similar plans were planned here in Whatcom County. They said we don't need that right now. We have enough testing for the need that we have at this point in time. And that's something we have pressed them on, and they've been pretty universal in saying that the testing they need is here. Obviously, opening of Northwest Labs back in I don't know if that was late March or early April. It all runs together, but that helped with a lot of testing, not only for Whatcom County. They're accepting tests from Skagit and elsewhere around the state to help the entire state out. But they feel very confident that they have the testing that they need here.
Great, thank you, Dave.
I can add something about business owners are really concerned about that. At least the sources I've been talking to, they are spending a lot of time thinking about their reopening, especially restaurants, trying to figure out how they're going to do dining in again. And, while not directly related to doing testing, they've been putting a lot of thought into trying to figure out what to do with their restaurant and, or their retail business and trying to figure out the new normal. It's something that really seems to weigh heavily on the business owners I've been talking to.
We've been reporting a little bit more into detail on some of those kinds of things as well, I think, because people just, community members want to know exactly what business has done to ensure that they're safe as we start to go back and get the economy rolling.
Right.
Dave Gallagher, sorry, as we wrap this up. So while coronavirus is still a huge health story, jobs and the economy have become, really critical as well. What do you expect you'll be reporting on in the next few months?
I think in the short term, I think we'll be definitely focused on how this phased reopening is happening and how it's, going with businesses. I'm already working on what, retail curbside delivery is, how that's working out. Who, the first story is like, who's doing it now? Who's trying to get that information out to readers about that, and trying to figure out if that's a working model that'll help them survive into the next phases. Will also be definitely, middle term. I think we'll be looking, not only at the businesses as the reopening, but I suspect there's going to be, unfortunately, businesses that don't reopen, and trying to keep track of, who is open and who's closed permanently. That's something, readers want to know about. Also, this pandemic happened so quickly that the economic data, it's had a tough time keeping up, and now we're finally getting reliable data showing us what's happening in the economy locally. And so I suspect I'll be writing a lot of stories about the economy in general and industries and who's being impacted more than others, and trying to keep track of, really what's going on with the economy through data, as well as, tracking owners down and talking to them as much as I can.
Do you want to put in a plug for how people can reach you? A restaurant opening?
Oh, sure. Email is the best way. And that's basically just dave.gallagher@bellinghamherald.com. And just shoot me a quick note if you're a business owner watching this. And also, I mentioned I have a lot of stories on my list, but I'm always on the lookout for more. So any sort of pitches that, or ideas or things you see out there that I should be covering that I'm missing, I certainly appreciate that kind of heads up.
Great. Thanks, guys. I have a question here from someone who said, it's good you see your face. It's good to say, well, we can't see your faces, but when we've met on Zoom or whatever, we've all realized how much we missed each other's faces. And it's been nice to at least have the technology available to do that. We're a staff of 7 here at the Herald. Warren Sterling, right there behind Dave's head, is our video editor. Dave and Robert Mittendorf, who's been dealing mostly with the government impacts on this, and he'll be spending a lot of time looking at the costs in the coming future. Kirelia, who's been here for 15, 16 years, I guess, has been covering healthcare and some of those impacts. And Denver Pratt has also been dealing with a little bit of everything, from some data stories to rentals to all kinds of things that are happening in the courts. So it's a small staff, but we like to think we're small and mighty. And we certainly count on the community to send us tips and information. We have a lot of ways you can reach us. We've got a newsroom at bellinghamherald.com where we're happy to take your tips. If you'll email any of us, we can send you our links to our Proton email, something that you're concerned about. Some of our best stories during the coronavirus have been from people who knew something, who thought the rest of the community should know it. And they reached out to us, and we were able to get enough facts to be able to put a story out. Question here from Hans that says, do you have any data on how many restaurants that went delivery only have been able to continue to stay open? Dave, what do you think? Are there any numbers?
I don't have numbers yet. That's a very good question, and it's definitely one I'm going to try to look into. I can tell you, the number of restaurants and drinking places in Whatcom County, it's around 480 to 500, somewhere around there. And I've seen quite a few people, and it'll probably be a story in the near future of business restaurants who started delivery and then stopped for a little bit and then revamped and started it again. And it seems like, again, this is just me guessing. It's the smaller restaurants have had a little bit more challenges in terms of getting that going and operating the smaller locally owned businesses. The corporate companies seem to have gotten that system in place. It's been interesting seeing how the local restaurants have done different methods, with curbside pickup, or even the owner delivering it themselves, and all kinds of different ways that they're trying to tackle this. And it's one of those things where I have driven around and watched some of the restaurants, and some places have done really well with it, and some are a little bit challenged, especially like in terms of the setup. Restaurants I've noticed that were kind of set up almost in a way for curbside, like Boomers, I've seen has done really well in terms of people just driving right up, after they put on their online order and getting their delivery and getting going. Whereas a restaurant that's maybe in a not a standalone building that doesn't have a real good curbside situation, they've had much more challenging times.
We've had several in our restaurant list. We've had several restaurants that have sent us notes in the last month and a half that they're on, they're off, they're on, they're off, and now it seems like they're coming back a little bit more. They're all planning for this phase 1 opening and phase 2 opening, I suppose.
Right.
To get people back. Well, great. Well, thank you all so much. I see we're out of time here. Many thanks to Dave and Dave for this behind-the-scenes look at covering coronavirus in Whatcom County. And thank you all for watching today. This video will be available on your website, Facebook, and YouTube channels if you'd like to share later. And with that, I'm Julie Shirley for the Bellingham Herald. Please stay safe and keep reading local.